Okay. Thank you all for joining us this afternoon. You're at our Forward Forum with Forward Boone County. We're going to be talking about mitigation prevention as COVID-19 positivity rates rise. I'm Pamela Lopez-Fettis, Executive Director for Growth Dimensions, Economic Development Arm for Belvidere Boone County. I want to thank you for your time this afternoon as we discuss mitigation prevention as COVID-19 positivity rates rise. And I just want to let you know that Forward Boone County is partnering with Boone County Health Department to bring you today's Forward Forum. And the Health Department is here with us today and every day to answer your questions and ease any kind of concerns that you might have. As a reminder that today's attendees are muted, we will hold a question and answer period after the presentation. You'll have the opportunity to direct your questions to the Health Department. We're also going to be recording this session, so you'll be able to share this with others. And we have other Forward Forums scheduled, and we'll provide you with those dates and times at the end of this session. I'd like to take this opportunity to introduce Forward Boone County. This group first came to be in April of this year. This was our idea to bring local leaders and organizations together to combat the impacts of COVID-19. These partners understood that we can be stronger together. And as you can see from the slide, Forward Boone County is comprised of organizations dedicated to Boone County and services here. Along with these partners, Forward Boone County has created an informational website dedicated to bring Boone County's current guidance for businesses as we work through Restore Illinois phases. This website can be visited at www.forwardboone.org. Now, today we are joined by Amanda Meal with the Boone County Health Department. Amanda is a registered nurse and has a master's degree in public health. She's earned her Bachelor's of Arts from Beloit College and her MPH from the University of Chicago. Her Associate's in Sciences in Nursing from Rock Valley College as well. Through the completion of an intensive graduate and undergraduate studies in the areas of nursing, public health, gender studies, and linguistics, she has a unique international and cultural internship experiences abroad. Amanda is academically and professionally motivated to address population health at the local level. And she has worked in public health for 15 years, currently overseeing the operations of Boone County Health Department in Belvidere, Illinois, as the Public Health Administrator. Welcome, I appreciate your time today, Amanda. Thank you very much.
Hi there. Hi, everyone. Good afternoon. Take off my face mask since I'm alone here in my office. Hope everybody can see and hear me okay. What a pleasure to be able to speak with our businesses here this afternoon. We wanted to organize a Forward Forum specifically related to the work that we're doing with our businesses to give you some information as we're watching the current situation evolve out there with COVID-19. The health department is committed to keeping people safe and healthy, but we're also committed to helping our businesses conduct operations safely during these challenging times. And we do have information that has already gone out publicly, but we wanted to have a real open, honest conversation with our local businesses to make sure that you are aware of the situation and how things are looking. So just two key points that I want to hit on to get started, and then I think we're going to open it up to questions. I'd like to keep this as informal as we possibly can, just so that you all have opportunity to engage with us in some discussion about what we're seeing, kind of what's happening. So the first piece of information that's important to share is every week on Friday afternoon, the county level metrics are updated through the Restore Illinois plan, and that's through Governor Pritzker's office and the Illinois Department of Public Health. And this afternoon, it was announced that Boone County, along with Winnebago County here in our 9-county Rockford region, has been placed on an orange warning status. Now that we've been in orange warning before, a couple weeks ago, we were in orange warning for a week. And what that means is there are 8 areas of data that are being tracked, or eight metrics, as we call them. And if 2 or more of those metrics are not within the range that we are tracking as far as thresholds for safety and public health reasons, then we get pushed into orange warning status. And we're asked by the state health department to look take a closer look locally at what's happening in our local community and how can we double down more, how can we outreach more, how can we do additional things to try to get those numbers back in a reasonable range. So that's the first piece of information I want to make sure that everybody knows, that Boone and Winnebago County are now in orange warning status, and we will be for the next week. The other piece of news that's important for our businesses to be made aware of is that over the last week or so, we've been watching our regional, so our 9-county regional positivity rate slowly increase. I would say for really close to a month, we were holding real steady 6%, 6.2, 6.5, kind of right in that 6, under 7%, we'll say. And really since the 15th, we've been watching that number increase. There is a 3-day delay or a 3-day lag in these data that are made available to us, and these particular data at the regional level come out daily, but it's behind by 3 days. And so yesterday we got all the way up to 7.7%. Today the data that was made available was 7.6%. So that was good news, but we're still really close to the 8% threshold. And when I say 8% threshold, what I mean is that if our entire region sustains a positivity rate at 8 or above for 3 consecutive days, then our region will go into what is called regional mitigation. And there are 2 other regions in the state of Illinois that you may be aware of that have been subject to regional mitigations. Region 7, which is the greater Will and Kankakee area, and then Region 4, which is the St. Louis metro area, so the counties that are right across the Mississippi River from St. Louis. And the mitigation measures that are put into place when a region goes into regional mitigation do affect our business community. I do not have information specifically on what it will look like here in Region 1, but I do have the information about the restrictions that were additionally placed on those 2 regions that are either currently or have recently been in mitigation. I am going to just read through those. These are not officially being placed on our region at this time, but these are the measures that were put into place for the other 2 regions that have had a positivity rate and sustained a positivity rate of over 8%. So for bars, all bars closing at 11 and may reopen no later than 6 a.m. the following day. No indoor service. All bar patrons should be seated at tables outside. No ordering, seating, or congregating at the bar. Bar stools should be removed. Tables should be 6 feet apart. No standing or congregating indoors or outdoors while waiting for a table or exiting. No dancing or standing indoors. Reservations required for each party. No seating of multiple parties at one table. Restaurants. All restaurants close at 11 p.m. and may open no earlier than 6 a.m. the following day. No indoor dining or bar service. Tables should be 6 feet apart. No standing or congregating indoors or outdoors while waiting for a table or exiting. Reservations required for each party. No seating of multiple parties at one table. Meetings, social events, and gatherings, which would be limited to lesser of 25 guests or 25% of overall room capacity, both indoors and outdoors. No party buses. Gaming and casinos closing at 11 p.m. are limited to 25% capacity and following mitigation for bars or restaurants if applicable. And then organized groups and recreational activities would need to continue to follow the DCEO guidance that are available on the DCEO's website and on our Forward Boone website for phase 4. So that being said, that is the series of mitigation measures that have been placed on 2 other regions that have reached 8% positivity or above and have held above that for 3 consecutive days or more. So the purpose of this call and the series of calls that we're hoping to hold with Forward Boone is to provide this information as a situational update, and then to clarify questions that you might have, guidance documents that you might need. And then also what we would really like to do is just ask for a call to action, not only from the community, but also from our business community. The last thing we want to have to do is take steps backwards or have additional mitigation measures placed on us by state guidelines because the circulation of this disease in our community is too great to continue the reopening that we've already started. So that being said, we're coming to you as soon as we can here. Before we get to that point, we're hoping to be able to take your questions, but also begin brainstorming. Maybe there are some additional things that your respective businesses can do to take added precautions to help us figure out how to keep the spread of this infection down, and what do we need to do to work together on this. So with that, that's just a brief situational update, and Pam, I will turn it back over to you. Thank you so very much.
Okay, I'm sorry about that. I'm trying to unmute myself. Thank you, Amanda. Now we're going to open it to questions for our attendees. So please raise your hand, or we can recognize you if you have a question. And we'll unmute your microphone as you respond.
Okay, as growth dimensions, I'm going to work here behind the scenes. I have Eric Miller. So I'm going to ask you to unmute, Eric, and you can ask your question.
Thank you. Matt, what's our hospital capacity?
Eric, you're live if you want to ask a question.
Yeah, this question's for Amanda. What's our hospital capacity right now in terms of ICU usage, those relevant statistics?
Yeah, so that information is put out both regionally and at the county level for certain metrics daily and for certain metrics weekly, and that's available on the Restore Illinois website. Do you have access to that information, Eric?
I think we'll have to unmute him again. There, okay. Sorry, let me find him again and unmute.
Thank you.
Okay.
Yeah, he's
Yes,
on.
I do have access to the Restore Illinois website.
Okay, awesome.
Thank you. Are there other questions?
Yeah. No other hand raises.
Okay.
Do we want to, as long as we have everybody on the phone, if we can go back and maybe talk about the upcoming testing sites that we have?
Sure, we can do that. I was just pulling up the Restore Illinois website. I feel like I live on that webpage here. So Eric and other people that might have this question, you're going to go to dph.illinois.gov/regional metrics, and then the region ID, we're region 1, and you can see the details listed right here. So there are several metrics that are tracked at the regional level: test positivity, which I already alluded to, hospital admission 7-day rolling average. We did see an increase on September 21st of hospital admissions with COVID-like illness, and the graphs are depicted, and the explanation of where the data comes from and how the numbers are calculated are also listed there. Hospital availability 3-day rolling average. They track med-surg bed availability as well as ICU bed availability. Med-surg availability, we're looking for a 20% threshold, so we don't want to be below 20%. Right now, that's tracking at 38%. Our ICU bed availability, also a 20% threshold, and that is tracking right now at 50%. If you continue to scroll down on the page, you're going to have information on the regional methodology for how the statistics are calculated within each region. And you're also going to have a breakdown of exactly where those numbers come from, all the way down to how they calculate the numerator and denominator if they're looking at a rate. So I hope that that helps. And that's updated daily for some of those statistics and weekly for others. So I would encourage people to continue to use that website as a tool.
Amanda, we have one question that came in through chat. How do we promote other healthy people and staff to get tested to lower the positivity rate?
That's a great question. So we're living in a different phase of COVID-19 than we were back in the spring. And I know that everybody is becoming very, very tired of the new normal that we live in, right? So just to clarify, back in the spring, testing was not widely available. Testing kits were not widely available. We did not have testing sites. We did not have the opportunity to bring mobile testing to our local community. Although we fought for it, we fought hard, and it took a while, right? So we do now have that opportunity. And we did just put out through the health department a press release in regards to the upcoming testing sites that we'll have here in Boone County. We're also in the process of compiling the list of mobile testing sites that will be available across the 9-county region over the next couple of weeks. We will have testing available next Wednesday, September 30th, and then Monday, Tuesday, and Wednesday, October 5th, 6th, and 7th. In addition to that, we have Physicians Immediate Care that offers testing here in Belvedere, and they have several sites in Winnebago County that offer COVID-19 testing. We have a community-based testing site at the University of Illinois Chicago that's open 7 days a week there at their Rockford campus on Parkview Avenue. And then we have Crusader Community Health that offers a testing site in the parking lot where the old Logley's and Schnucks used to be on North Rockton Avenue. They have a site that's open there Monday through Friday. That information that I just listed off is all available on our website, and it's also available on the Forward Boone website. We do know that there is a group within our population that are asymptomatic. They contract COVID-19 and they don't have any symptoms. And so we do want to encourage testing widely across the community so that we can have a better sense of exactly what is the burden of disease, right? So we don't just want very ill people or people who are sick with symptoms getting tested because we're experiencing moderate community transmission. So we're no longer experiencing minimal transmission here. We're experiencing moderate community transmission. We want to get a sense of exactly what that burden of disease is. And the only way to do that is to take a cross section of the population at random, have testing done, and then really just have a better sense of how it's tracking. Just so you all know, that happens every year during flu season. That's something that we do with influenza. We have what we call sentinel sites. So we have clinics and hospitals who provide testing information to us on a regular basis. We don't necessarily do any follow-up with seasonal flu because we do have a vaccine that's widely available, and we do have measures in place to protect and prevent against the flu, but we are able to track every flu season every year the percentages of the burden of disease in our community, and we watch those numbers. We actually work really closely with our schools specifically. They call us and give us percent rates of students who are out with influenza-like illness, and that's how we determine if we might have an outbreak on our hands of flu or we might have some increased local spread. So we're moving into the time where we would begin to do some of that with COVID-19 now that we have a lot more testing available and we have a lot more capacity to be able to figure out exactly how this is spreading, but how widespread it really is becoming in our community.
Okay. So Amanda, another comment, CDC publicly stated that people are not showing symptoms do not need to get tested. So if only people with symptoms are getting tested, the positivity rate will go up. So is the county going to prepare a public statement regarding this?
So we came out with a public statement that not only our 9-county region, but the Illinois Department of Public Health came out with a statement sharing that that was not an opinion that we shared with the CDC. And just an update on that, the CDC has actually retracted that statement. And they are not continuing to promote the idea that people with a known exposure do not get tested. So that is changed.
And can you reiterate what the positivity rate is currently for Boone County?
Currently for our county at the county level, yeah. So that is tracked on a weekly basis, and that information is hot off the press, we should say, because it comes out around lunchtime every Friday. And our current weekly positivity rate for Boone County is 9%. That is one of the metrics that has pushed our county into orange warning status for the upcoming week.
Thank you. So I don't see any additional. I'm sorry. I don't see any additional questions, but I just wanted to reiterate that we are going to have some forward forums coming up. We have another one on Monday, September 28th at 8 a.m. and another one at Tuesday, September 29th at 7 p.m. We encourage that if you didn't think of a question to ask now, feel free to hop on again to ask your questions, or you can feel free to contact the health department at the number provided on your screen. So we want to thank you, and again, thank you for joining us. We do have the link for the web address for the Department of Public Health, so you can track these numbers on Forward Boone. Again, you can go to www.forwardboone.org, or you can reach out to the health department, and they have a link to Forward, as well as these links to these resources. Again, thank you, Amanda. Thank you, everyone, for joining us today. Again, please stay safe. We appreciate everything all the business are doing, and how we could thank you for making Boone County strong and working together.
Thank you.
Thank you.